I called your office yesterday at 3:30 to ask if there were any upcoming town hall meetings. I was told no, hold a few minutes.
Okay.
And they came back and they said no, and there aren't any planned. Now, I understand this is at a senior center and there's a little bit more targeted town hall, but nonetheless, that answer probably shouldn't have gone out. So that's just point one. Point two, this gentleman up in the front was talking about individual choice and responsibility rather than government program like Social Security to take care of people and having that in lieu of individual responsibility. And you mentioned the stock market dipping down to 6,000, right? And I think that's a little disingenuous because, as you know, if you're investing in long term, a dip like that's not going to matter. When you're ready to go to retirement age, you can go to something that's a little bit more secure. You know, the stock market was at 6,000. Where is it now? So that's a bit of a disingenuous argument. But my question is that the CBO projected the Affordable Care Act to cost $940 billion over 10 years. It is now at $2 trillion, and it's not even implemented. When this finally does get implemented, where does that additional money come from? Because it's not going to be $2 trillion. It's going to be far more than that. And we already have, what's the debt stuck at now? 16 trillion? And hasn't gone up mysteriously in like 3 months.
So, you know, in terms of CBO,
where's
we've
that
been
come
around and around in this in other town halls, and we did, you know, one in Wyndham recently at the middle school, which was completely wide open, advertised in the paper. There was an advertisement about, I mean, you kind of only gave half their analysis, okay? Because in fact, if you look at the full score, the full analysis that CBO projected, in fact, they showed it as saving the deficit, and it did. Again, there's a lot of people who vehemently disagree with that. It shows that it reduces, yeah, absolutely, and I'd be happy to give you that report, okay? Because this has been gone over ad nauseum down in Washington. Now, again, part of the reason is because there has been reductions in reimbursements for Medicare Advantage, which we talked about here earlier, cut spending in the Medicare account for Medicare Advantage. It reduced some of the reimbursements to hospitals, which they supported as part of it. So there was cuts included in the Affordable Care Act in terms of different payments through the Medicare program. There was also revenue, which is being generated by the law, the Affordable Care Act. Again, it raised the Medicare payroll tax for unearned income, particularly for income above $250,000, and that's one of the reasons that the trustees gives the program a stronger bill of health. Right now,
10 years of revenue.
But I'm just telling you that, you know, that's the score we're at now. But the good news is that since the Affordable Care Act was passed, okay, if you look at the trajectory of Medicare spending over the last 3 years, okay, this past year, Medicare cost growth per capita is under 1%. That has never happened in the history of the Medicare program since it was passed in 1965. There is a sea change that's happening out there in terms of healthcare delivery, again, because of some of the incentives that are built into the Affordable Care Act. I'll give you one example. Okay, the Medicare system has told hospitals in this country that if people are readmitted within 30 days for a select number of conditions, like congestive heart condition, which I've talked about earlier, which my dad had, within 30 days, you're going to start being penalized on your reimbursements, because that's an unacceptable, from a public health standpoint, track record of people being readmitted. It's not for like if you had a car accident or a heart attack or a stroke or anything like that, but there are manageable chronic illnesses that should not result in people being readmitted within 30 days of each event that you've been hospitalized. And if you look at Connecticut right now, 8 hospitals actually this past year actually surpassed that target, the median for readmission. Manchester Hospital, Rockville, where I live, Bacchus and L&M were a little bit under the target that's there. But what's happening is hospitals now, when they discharge somebody, aren't just saying, hey, you know, have your daughter come pick you up on the sidewalk here. They actually have to come up with an outpatient plan using home health services, which is far cheaper than emergency rooms. And those kinds of, you know, reforms to delivery of health care are one of the reasons why that trajectory of Medicare spending is going down. And again, it has been embraced by the medical community and by the hospitals, because they realize that this system, you know, can do far better in terms of how it delivers healthcare. And I would just say for Rite Aid, or for the small businessman, or the person who's buying the insurance through the exchanges, that's the way you actually, in my opinion, reform healthcare, which is that, 16% of GDP for healthcare spending, that's not Australia. Australia is in the single digits in terms of their GDP spending on healthcare. Europe, you just go, we are so much of an outlier in terms of how much we're overspending, I think, because of a fragmented system.
Because government is.
Well, I don't think government is the cause of that, and nobody's, God, doctors are not working for the government. Wyndham Hospital is still an independent, freestanding, nonprofit hospital. Again, the ownership of these institutions and practices has not changed because of the Affordable Care Act. So again, I will send you, and if you could leave your information, the CBO score, which I'd be happy to supply you with, and we can